Hi, I'm Brian Werner. I'm the president of the Werner Institute of Balance and Dizziness. I want to take you on a personal tour of our facility and give you an idea of the testing and treatment techniques we're using in the management of the balance patient. Let's go. This is a snapshot of some of the patients we're treating here at the Werner Institute. To date, we've treated well over 3,000 patients with balance disorders.
The therapy procedures we use at the Werner Institute incorporate rail systems, they incorporate different surfaces. We try to do dynamic exercises as well as static exercises. Here, Jason's actually challenging the patient using the harness system to help protect him so that he could work at the highest level of function and get the best gains from the physical therapy. As you can see his feet, he's really working hard to try to keep his balance and try to maintain his stability. All the while he's protected using the rail system. We also use the same body weight of support over the treadmill to help patients who are trying to walk again, and this helps keep them from falling off of a treadmill. Just as important as dynamic balance, there's static balance training. You can see our patient here. He has his eyes closed, he's turning his head. We have him in the same protection system. The Goldman rail system protects him. The idea is that we want to keep him safe because he's going to push himself potentially to a point of fall, and he has that to keep himself from getting hurt. The surfaces are unstable. We use foam cushions, we use wobble boards, but the push is to try to improve balance and try to enhance performance. Gaze stability is just important in balance. As you can see, Jennifer's using the Wayne Static light board. She's trying to follow the lights around the device. We use unstable surfaces to help challenge the patient. But the idea is she's trying to beat a score, and by pushing her balance system through her eyes, she actually can help reduce dizziness. We also use the VisFlex system. This is a light bar designed to stimulate the patient and try to force the patient to use their eyes to improve their performance for balance. A new technology we're using at the Werner Institute is near-infrared light. It's designed to increase blood flow to the feet and reduce pain and numbness in patients with diabetic neuropathy. Here again, we have a patient challenging his balance, irregular surfaces, eyes are closed, head movements, all to try to encourage increased balance performance and reducing his fall risk. AARP did a study in the early 2000s and looked at balance and falls, and they found that strength training is actually one of the most important things to do for balance. As you can see, Patty's using our Cybex system. We use lower extremity squat. We do inner and outer thighs to help improve their strength and to reduce fall risk. But the key truly is strength for balance, in that by having stronger lower extremities, you can actually decrease your risk for falls and improve your performance in your daily activities. The primary testing procedure we use in the clinic is computerized dynamic posturography. As you can see, the system actually moves. The walls are moving back and forth to challenge vision. The floor moves in order to challenge her balance and standing. We can take that information, we can put it on the computer, we can objectively measure it, we see where the patient's falling, and that will help us determine how to treat the patient and how to reduce their risk for falls. VAT, or vestibular auto rotation test, is a visual test designed to measure eye stability. We can look at the graph and actually determine what type of exercises to do for your eyes. And by using that information, we can better determine why you're getting dizzy. The last testing we use is infrared video oculography. Infrared is a form of balance testing that allows us to look at your eyes in the dark. We could look at your eyes with your head still, or we can actually look at your eyes with your head moving. Both tests will give us a better idea of what's causing your dizziness.
I hope you found the video informative, and I want to thank you for taking the time to visit the Werner Institute.